Welcome to this presentation that's all about the flu. Yes, the flu has arrived at FSU, and hopefully by watching this, you will be more educated on what the flu is, what the symptoms are, when to seek medical care, how to prevent it, how to treat it, and how to stay healthy during the cold and flu season. Many people call many different illnesses the flu. The true flu is caused by a virus called influenza, and the level of illness can vary. Sometimes people get very mild symptoms and don't even realize they have it, while others can become severely ill, even resulting in death. Antibiotics will not work to cure the flu. Antibiotics only work on bacterial illnesses, and the flu is caused by a viral illness. In fact, there are no medications that can cure a virus. Some medications can make it go away quicker or control the symptoms, but there is no true cure for a virus. Unfortunately, living in dorms and sitting in classrooms frequently puts you in close proximity to many other people in confined spaces. Many viruses are transmitted by what is called respiratory droplets. When people cough or sneeze, the droplets are propelled into the air you breathe. So you can acquire it just by breathing in the same air as someone who has the flu after they have coughed or sneezed. Also, what goes up must come down, and these droplets will then settle on desks and furniture, and they can remain alive for several hours, so you can be infected by touching things and then touching your face or your personal property. So are you paranoid about breathing and touching things? The best thing you can do is wash your hands frequently. Don't reuse tissues. Many people stuff them in their pockets and then pull them out again to use again. That is not good practice. If you need to cough, cough into a tissue or into your elbow rather than your hands that will touch other things and people spreading the virus. Dispose of tissues appropriately. Try to keep your environment clean using antibacterial cleaners. If you suspect you have the flu, seek medical care. The antiviral medications that can be used for the true flu need to be started within 48 hours of when symptoms start. Most important, if you have the flu, try to stay home and not spread it around. So how do you know if you might have the flu? In most cases, the symptoms that develop from the flu come on very, very quickly. It generally starts with a sore throat and progresses to fever, cough, runny nose, total body aches, fatigue, and headache. These symptoms generally will develop within 2 days, and you will have difficulty doing normal activities. You will just feel so exhausted. On the other hand, colds tend to develop very slowly but can have the same symptoms. Fevers tend to be lower with colds, but that is not a concrete rule. Cold symptoms oftentimes linger for weeks, and most people can treat them easily with over-the-counter medications and continue on with their normal activities. So when should you definitely head on over to the Brady Health Center? If your symptoms come on quickly and you have most of the symptoms listed here. Just as a side note, nausea, vomiting, and diarrhea are not typical symptoms of the flu, but they can occur. So if you have them along with these other symptoms, you should seek care. So many people think that because it's a viral illness and not curable, why bother with treatment? Flu tests are quick and simple, and you'll know for sure whether you have the flu or not. It also provides information for tracking and trending purposes. If you know you have it, you can avoid spreading it around. The antiviral medications that we use will shorten the length of the illness and decrease the length of time that you are infectious. Spreading it to young, healthy people will generally just let them be as miserable as you are. But if you take it home to a newborn or a grandparent or someone who has an impaired immune system, it can cause death. Death has been reported in people of all ages, so it is considered a serious disease. That's why you hear so much about getting immunized. Anyone can develop complications, but the people listed here are at an additional risk. Anytime the immune system is working to maintain health for other reasons, it can be overwhelmed by something like the flu, making the course of the disease much more severe. Obesity has been identified as a risk factor for influenza infection in the 2009 flu epidemic. You can easily calculate your BMI using a simple tool where you plug in your height and weight. I've included a link here from the Center for Disease Control. It can mean the difference between life and death if you have serious symptoms or complications and you don't get medical attention no matter what age you are and whether or not you've had any other risk factors. If you develop any of these symptoms, you should get immediate medical care. Most colds and illnesses in adults result in low-grade temperatures and don't often rise above 102. If you feel like you just can't get warm or you're shivering all the time, shortness of breath, feeling like you can't get enough air or take a full deep breath without pain, pain in your chest when you cough, cough up dark yellow, green, or bloody mucus, or uncontrollable coughing. You should get medical care to have these symptoms evaluated. If you have the flu and are on antivirals, or even if you don't have the flu, it's okay to take some over-the-counter medications to help you feel better. Just make sure you pay attention to what you're taking and try to stay with one product so you aren't accidentally taking too much of any one medication. Many medications contain the same drugs or a combination of drugs, but may be marketed differently. Antihistamines dry you up and help shrink swollen mucous membranes through allergy pathways, opening up your nose and airways. Cough suppressants only help to control the cough, while expectorants help to thin mucus so it can be cleared easy. Decongestants also help shrink the swollen mucous membranes by shrinking the blood vessels. Acetaminophen, ibuprofen, or naproxen can help with fever, pain, and inflammation. Saline nasal spray can help thin mucus, making it easier for the body to get rid of the mucus. If you're using these medications for more than 7 to 10 days, you should be examined for an underlying infection like a sinus infection, strep throat, or pneumonia. It's very important not to use aspirin if you're ill because it can be associated with something called Reye syndrome. Reye syndrome is a rare but extremely serious disease that occurs generally 4 to 6 weeks after a viral illness like influenza or mononucleosis. It has been linked to aspirin use. It causes brain swelling, liver swelling, and fat accumulation in the liver and other organs. This can result in seizures, organ failure, loss of consciousness, and even death. Survivors of this syndrome usually have some type of serious permanent injury like brain damage or organ failure. If you notice that a friend or classmate who has been ill recently suddenly develops confusion, has a seizure, faints, get them medical care immediately. If they're uncooperative due to confusion, call an ambulance. It may save their life. So how do you stay healthy during the cold and flu season? The most important thing is to stay hydrated. There are various recommendations from many different sources on how much you should drink. As a general rule, 8 to 10 8-ounce glasses a day is an average amount. If you frequently feel thirsty, you're not drinking enough. Choose decaffeinated drinks if you can. Caffeine tends to make you lose more fluid than retain. Your body cannot stay healthy, fight off illness, or recover from an illness if you are dehydrated. Eating healthy also helps keep your immune system functioning correctly, as well as overall good health. Antioxidants are like scavengers in your body. They look for the bad stuff and they destroy it. This is a list of some foods that are known for having a lot of antioxidants in them. The rawer, or in the more natural state you eat the foods, the more nutritional benefit you will get. Cooking does decrease the amount of antioxidants, vitamins, and minerals that are in foods, so try not to overcook things. Yogurt contains probiotics, which are the good bacteria in your intestines. Mushrooms contain selenium, which is known to boost immunity. Most people don't eat healthy all the time, so a basic multivitamin can also help make sure you have the essential vitamins and minerals you need to stay healthy. Exercise doesn't have to be punishment, and it doesn't have to be excessive. Moderate exercise most days of the week produce the good effects listed here. It is important for your heart, though, that you do exercise enough to raise your heart rate slightly and keep it elevated for 20 to 30 minutes at a time. You should still be able to talk with a little bit of breathlessness, and you may need to work up to it gradually. Flu shots do help. Every year, shots are changed to cover the strain or type of flu, the virus, that the experts predict will be the most predominant flu of that year. Sometimes they're wrong. It's a best educated guess. But even if they're wrong, the antibodies that your body produces may recognize similar viruses and provide some degree of protection. If you have the immunization and still get the flu, it generally will not last as long or be as severe as it could have been if you didn't get the shot. It is not true that you can get the flu from an immunization. It is not a live virus. The nasal spray immunizations do contain live virus, but studies have shown that the immunity produced is substandard. So they don't recommend that formulation of the immunization any longer. You should get the shot. Pregnant women are encouraged to get the flu shot, and the general population starting at age 6 months and over should receive them. If you have a question, you should discuss it with your provider. You may get a normal reaction that occurs with many immunizations, and that is low-grade fever, aches, soreness, and you just don't feel well. But it's usually short duration and it's not severe, doesn't interfere with your normal day-to-day activities. Guillain-Barré syndrome is a progressive paralytic disease that has been associated with the immunization, but it also can occur without having an immunization. It was recommended in the past that if you've ever had that syndrome, you should not receive a flu vaccine, but more recent information has led the experts to say that now it's just a precaution. So that's again something you need to discuss with your provider if you've ever had a history of Guillain-Barré syndrome. I've listed some reliable websites here where you can get accurate information. Beware of what you read when you Google things. You can trust sites generally that end in .gov. Feel free to post any questions on our Facebook page too, and we'll try to answer them. So what did you learn here? This is a quick 5-question true or false quiz. If you answer these questions and turn them in along with your point sheets, you'll get some additional points towards the competition. This is just a list of where the information from this PowerPoint came from. And again, if you have any questions, feel free to post them on our Facebook page. Thanks for taking the time to listen, and stay healthy.